Mr. Shoarega, thank you for agreeing to be interviewed. I wondered if we could start off by saying your name and what your title is and your relationship is to the Ethiopian government.
Okay, thank you very much. My name is Wendasan Shoarega. I'm a MR focal person in Ministry of Health. Ministry of Health is the coordinators for the National Antimicrobial Resistance Prevention Containment as one health approach. So we are a secretariat for AMR, the national level.
What do you think are the main issues with respect to tackling AMR for Ethiopia? What do you think are the main hurdles and barriers?
Yeah, there is a lot of challenges in AMR, like wars, like in Africa. The barriers and the problem also exist in Ethiopia. So there is various challenges or problems existed in our health setting, in our agriculture setting, and in the environment sectors. So we have a lot of problems. We can take it. One of the main problem is that the awareness and the educations. Most of the health professionals, including the animals, the environment sectors professionals, are not enough aware on the AMR issues. And the other, even the publics and the policy makers, the decision makers are also not that much well aware on AMR. Its own impact, its own consequence, it is on a burden. So that's the main challenges for implementing AMR related activities at the national level. The other one, the main problem is that the accessibility of essentials, antimicrobials and microbiology supplies and other agents, that's the main issue in our country because we know that microbiology supplies is very important, essential for getting the evidences about the resistance issues, about the resistance strains, just to prescribe, just to dispense medicine. So in order to prescribe medicines, we need to have an evidence. So for that issues, we lack microbiology supplies, reagents, even our capacities for microbiology lab are very limited. We have only 16 sentinel sites.
So one of the major issues appears to be access. Access to equipment, access to consumables that mitigates, if you like, the ability to do diagnostic microbiology that then informs what antibiotic to use.
The access issue, even not only the access issue, the quality even is very critical because we purchase different discs and different reagents from some countries from outside of the country, but most of them has the qualities are very compromised and not have qualities to decide any related issues. So that's a problem also. There is also another main challenge, that is the regulatory enforcement. You know that there is a lot of channels getting to or importing to the countries from different countries that substandard and falsified medicines are circulating in our countries in different ways. So that's a problem. That's the main problem for development for the AMR prevalence of the countries. You have to check in Addis or in other countrysides of Ethiopia. There is a misuse and there is irrational movement or distributions of those substandard and falsified medicines in the country.
So supply chain is, once it actually gets into Addis Ababa, supply chain throughout Ethiopia is also a problem.
Yeah, exactly.
So we've stated what the issues are, which are, I think, quite significant. How do you feel this could be tackled?
Yes, Ethiopia has developed the AMR's One Health AMR strategic plan before 10 years ago. We revised for the third times, and we have a 2021, 2025 One Health AMR strategies. In these strategies, it is focusing on the 5 strategic objectives. It is mostly a blueprint of the global strategies. The first one is awareness and educations. So awareness and educations for the communities, for the health professionals, even for the media professionals, and the policymakers is very important. So we understand that, and we are doing a lot of activities in these areas. The other activities is surveillance and research. We do have a lot of gaps in these areas, as I told you before, because the surveillance and research is very important for decisions and for evidence generation. So we have also allocated more than 60% of the estimated budget for our strategic plans for surveillance and research, because it is a resource intensive and it is more amount of monies for implementing and capacity building for this activity. So we identified surveillance and research as our priority areas for Ethiopia to tackle AMR. The third one, infection prevention. Infection prevention is priority interventions. We do have a lot of experience in Ethiopia during the COVID time and before the COVID times. We do have a good experience on infection prevention and control. So we have also selected or identified infection prevention as our priority areas for preventing or tackling antimicrobial resistance. The fourth one is the prudent use of antimicrobial resistance, and this strategic objective, including the qualities, the access, even the disposals and the waste management, also included in this area. So antimicrobial stewardship also included in this area. So the prudent use of the appropriate use of antimicrobial is the main areas for tackling of AMR at the national levels. The fifth and the very interesting objective is the partnership, coordinations, partnerships, again, the resource mobilizations, because a lot of investment or less of resources needed for tackling of AMR, because AMR touch the environment, the animal sector, the human sector. So to effectively implementing those activities, the partnership, alliance, and coordination, even the resource mobilization is very important. The partnership within the government organizations and outside of that, the privates and others, UN and others, non-governmental organization partnership is very crucial, and we identified that. So based on that these five strategic objectives, we implementing for the past 3 years as a national level to tackle AMR.
Okay, thank you very much. That's a very comprehensive answer. You know that United Nations high-level meetings in September to discuss antimicrobial resistance. What would you like to see come out of that high-level meeting in September?
Yeah, it is. I think it is very critical meetings for tackling AMR as a global nations. So we have to use these opportunities for addressing AMR. Really is really a challenge. Really, it is very it is a pandemic for the future. So we have to show any evidences, any things that happening in our countries, also in Africa, and in the global level. So we have to use these opportunities by informing the participant or the country's representatives that AMR is a silent pandemic. They need urgent measures, or they need to have collaborate. They need to have make a partnership for tackling this issue, because you know that around 5 million people are dying every year because of AMR. It's also affecting the economy. It's also affecting the environment, the animal sectors, overall issues. So AMR is very challenging, and it comes aggressively to attack the human being and the survival. So we have to use this one. And the others, the very critical issues are the low and middle income countries like Ethiopia are limited resources. We have limited resources and limited humans, a limited capacity to tackle AMR. So we need support from the others country from the global. So because in order to implement this AMR related activities, we need to have a support for tackling this critical issue, because you know that different, even AMR is not specific for specific pupils or selected people. It affects all human beings. It all affects the environment. It affects all the animal sector. So we have to come together to tackle AMR. I need to send a message like.
Okay, so you've answered this question in part already, but being brave and being bold, what would Ethiopia's message be to the United Nations in September? What would be your priorities in terms of what are the things that you would like to come out of this, not just for Africa but specifically for Ethiopia?
It is known that we have tried to do a lot of activities by our own resources, by our own capacities, but the problem is very huge, very serious. So I need to say we have to collaborate it. We have to partnership. We have to generate resources from the global levels. So to tackle the AMR. So we need the supporters from other countries, from the developed countries, and even not only that, the African people will come together to tackle these issues, because antimicrobials are limited resources. We have a limited antimicrobials. Most of them are making resistance, so we have a little number of antimicrobials are using effectively for the treating of common infection. So to preserve these antibiotics, I think the time is now to preserve these antibiotics. So we have to come together. Our higher officials, our representatives at the country levels will take it as priority issues. Even not only for the global, for African leaders, they have to be one of the agenda for African Union's meeting and others critical meetings, because this issues is a human being issue. This issues the animals, environment issues. Even not only that, the economic and the survival issue. So we have to come together to tackle this, and we need to strengthen our efforts for the futures. Unless we are on serious issue, we are on the problem.
Borrowed time. So thinking long term. So we've spoke about what your message would be to United Nations and what you would like to come from that meeting. Thinking long term, let's say 5 years or 10 years away. What would you like to happen across Ethiopia to tackle antimicrobial resistance?
Really, to say that. Really, the treating of critical infections, not only the critical, also the common infection, is very challenging for our healthcare settings. We have mentoring, we have supporting hospital in different times. At that time, the physicians, the pharmacists, the nurse have its own challenging issue, because it is a critical issue, because not only the adults, not only the youngest pupils, even the newborn childs are affected on this issue. So we have to come together to work in that. So in Ethiopia, we have planned to different activities for implement, for tackling of AMR, for containment of AMR, preventing of AMR in different issues. So I think if we get any supporters, if you come together to work in these areas, I think we have to tackle, we have to preventing the problems for the coming years. So our health systems is on challenging because of the different issues, because of surveillance in the research issues, because of availability of diagnostic issues, because of the access of essentials, antimicrobials, and diagnostic supplies. There is also infection prevention and control is not that much satisfactory in our healthcare setting. So you have to work on that. And the other one is we have to integrate with our existing healthcare systems, because MR by itself is not effective. MR alone will not be effective when we are not integrating with the existing system. So we have to work we have to integrating the MR related activity with others initiatives existing in the healthcare system. So I think our African leaders, our global leaders will emphasize to these critical issues. So we'll do more for the next years.
You spoke about access, really, really important, the difficulties of access, getting diagnostics in and maybe antibiotics as well, and then the supply chain, throughout Ethiopia. You've spoken about prevention. You spoke a little bit about public awareness, but also, are there specific education programs that go on within Ethiopia, and do you think there's room to improve them for doctors, for nurses, and also actually scientific researchers?
Yes, we have doing a lot of activities in awareness and understanding initiatives by using different platforms. Just for the community, we are using a radio, televisions, and other social medias, and the public figures also we are using to aware of the community. In addition to that, for the health professionals, we are doing every time capacity building trainings by using in-person trainings and online trainings. We do have also. This is not only for human health; it is also applying in the animal health also. So we try to cover health professionals to aware on AMR, but we have a lot of health professionals at the national level, so it's not able to address in short time to all health professionals are aware on AMR and understanding about the impact of AMR. For the Ministry of Health and for the Ministry of Agriculture, even for the environment, the awareness and understanding issues are the main areas for preventing and tackling of AMR, and we have doing on that.
Mr. Shoarega, I think we covered everything comprehensively. Thank you very much for your time.
Thank you very much, sir. Thank you.